Traditionally, the Batwa depended on forest products for medicines and food for the community. But their isolation from the forest increased their exposure to many illnesses. As a result of the eviction, the Batwa lost access to many traditional forest products that worked as medicines and food, greatly contributing to their good health. Dr. Rinetwe Edward told Urban TV that the health unit in charge of Bugama Health Center 4, a facility that was constructed by Idris UK in partnership with the Church of Uganda, is the biggest on Lake Bunyonyi. The health facility is supported logistically and financially by the government of Uganda.
We have the tropical medicine of the Slovenia that normally provides or send a group of white doctors who normally come and operate 3 months, and they have a break off of 1 month and another group comes. Then we have Idrissa UK that constructed this general OPD where we are operating from, and we have the local government or the government of Uganda that supports the staff or that pays the staff who work from here.
Rinetwe explains that the people here have difficulty accessing health services provided by the Ugandan government due to limited transport. As a matter of fact, their main means of transport is by water.
I found that 100% of my clients who come to access the services at Bugama, they all travel by means of water. 65% of them use the canoe because communities around formed the groups and mobilized the funds and bought the canoes, which they used to come and access the services.
According to Mazingwe Wilbur, the chairperson of the Batwa community we visited recently, they have so far lost 4 children to a mysterious disease. Nearby clinics, also insufficiently equipped, charge at least 10,000 shillings at a single visit. While the free government hospital is available, they cannot afford to hire a boat at 20,000 shillings to cross over to where the government facility is located. This girl, ailing with a rotting skin, cannot get treatment due to lack of money. But according to Dr. Rinetwe, not so long ago they started providing antenatal care and free transport to the health facility for expectant mothers. Almost all of them cannot afford the transport fares to and from the health center on their own. A lot of sensitization has to be done to inform residents about the availability of these services.
We found out that people never knew that we could as well conduct deliveries at Bugama Health Center 3. They never knew that staffs were sleeping around, so people feared to come. They knew they would not find anybody. To solve that, we embarked on giving our phone numbers to pregnant mothers. And every pregnant mother who comes for antenatal would go back with our phone number, such that in case time for delivery comes, he uses our phone for easy help.
But that is not all. Health workers at this government facility are faced with numerous challenges.
The staff quotas were still a problem. Up to now it's not yet solved, but our people are suffering. At least we improvise the way we can, that at least one of the medical person keeps around 24 hours. That's one of the reasons why I am here, because I would have also gone to see my family.
Bugama Health Center 4, located on an island, does not have access to electricity, but the Slovakian Doctors Community Outreach has provided a solar system. But the solar system does not have the capacity to provide power consistently. In order to access antiretroviral treatment and other care and support services for men and women living with HIV, Batwa have to walk approximately 5 kilometers. Shelter and sanitation is another major health concern in the community. Poverty and lack of land makes it extremely difficult for Batwa families to build sufficient shelter with adequate sanitation. As a result, babies and young children are at high risk of pneumonia during cold seasons, with hygiene-related diseases spreading easily across families.
Bugama Health Center 3 is actually the only hospital that exists on this island, which is the biggest island on Lake Bunyonyi. It's called Bugama because it was the island where people who had leprosy were brought to for treatment and abandoned here so that they cannot infect other members of society. This hospital is being supported by the government of Uganda and of course in partnership with the Church of Uganda and also other Slovakian doctors who are rendering free services. In a day, they see over 40 patients, but when the Slovakian doctors are around, they meet up to 80 patients to help and improve the health in this part of the country. Joshua Poro, Urban TV, Kabale.